Tomorrow, New York's Four Seasons Hotel starts hosting the city's medical professionals. That's right. The idea is to give them a safe, clean space to go after a long day in the hospital. It also allows them to keep their families isolated from the virus, in fact, if they catch it. Rudy Tauscher is the general manager of the hotel. Dr. Robert Quigly of International SOS was brought in to help consult on that. Both are live with us tonight. Mr. Tauscher, I begin with you. It's a brilliant idea that we read about that you're doing. When did you decide to do this and why?
Thank you for having us. Last week, we got a call from our owner, Taiwan, and he has been asking to follow the call of Governor Cuomo's call to action. And since then, our entire team has been working and preparing the hotel. We have implemented enhanced protocols and procedures under the guidance of Dr. Quigly, who is also with me. And I'd like to thank you for the extraordinary collaboration that we had between government and private sector. It was extraordinary of everybody who came to help and finding our way in this uncharted territory. So we are proud of all our teams here in the hotel, to our offices in Toronto, Four Seasons, and to Mr. Warner himself. We are working very much under the health and safety protocols of that our guests and employees are as safe as possible. It's our top priority, but it's also time for us, we thought, to help those who have been traveling to the city, which were humbled by the selflessness and the bravery and generosity, and together with everybody, we'll get through that.
Dr. Quigly, can you give me an idea of what your consultation entailed to make sure the hotel was in the right shape to welcome in healthcare workers?
Certainly. But first, I want to say how much of an absolute privilege it has been for me to participate in this process. The cooperation and the collaboration with the Four Seasons staff was truly unbelievable. And for me, it was not only an adventure, but it was quite enjoyable because we were working so well together. Basically, we came into a bricks and mortar, and we decided we have two populations we have to take care of. First and foremost, it's the employees of the hotel that will be there during the visiting of the healthcare professionals, and then, of course, the healthcare professionals. And so we assembled a crisis management team, for lack of a better word, with senior management and my team, and we literally did walkthroughs over and over again, thinking of all the possible permutations and combinations that could result in exposure, in particular to the staff, Four Seasons staff. And so rather than covering up, we stripped down. So we removed a lot of the displays, a lot of the furniture. We made the pathways very simple throughout the hotel. We limited the section of the hotel where the healthcare providers would be present. We have a single point of entry on 58th Street. That entry is where people get screened, both staff and the visitors alike. The staff then are diverted to a segregated part of the hotel where they do their work, and then the visitors will come in if they pass the screening. We have zones within the infrastructure, red zones, orange zones, and green zones, and they speak for themselves. If somebody does not pass the screening process, which is temperature and questions, they are relegated to the red zone, and they are managed accordingly. The nurses that we have working around the clock at entry point are doing an extraordinarily good job, and we've done drills all day today.